people now. 40. Hello, everyone. You caught me mid-sentence. Okay, so welcome everyone who is with us tonight. The first thing I would like you to do is to type into the chat and let us know if you can hear us. There is a bit of a delay. Oh, hello, Jess? Oh.
You can't hear you. They don't know what you're saying.
I said, I thought you were saying you can hear and see us. Okay, so she can hear. Thank you, Amy. Crystal, yes. Pamela, Helen, yes. Hello from Calgary, yay. Christy,
excellent.
Wenna, Angela, this is all great. All right, thank you very much, everyone, for letting us know. And as I said, welcome. We're going to start the presentation in a second. At first, I want to introduce myself and my co-host tonight. So I'm Lorene Sauro, and with me tonight is Jessica Sherman and Katie Rietzma. And
Hi.
so we're all three of us are on the CanPro board of directors. We work as volunteers. And we do have a fairly large board that is from different parts of the country, so we have good representation. And so we're here tonight to discuss some of the issues that we face in our profession. And that's what we're going to do tonight. So I'm going to bring up the PowerPoint. Thank you. I'm going to bring up the PowerPoint. And right now it's not there, so now I got to go back in here. Sorry, this is a bit tricky sometimes with this system, getting the PowerPoint to behave itself. All right, we will try again now. There it is. Share. Okay, so Katie, this is now full screen, right?
Okay.
You got it? You see it?
I think so. I don't think I know how to turn my camera off because I'm little in the corner right now, but I see the big screen.
Yeah, you just go back up into the top right and click on that thing. It'll, if you want to. Otherwise, you're just there.
I'll see if I figure it out. If not, everyone will just see me.
I was going to say, people like people, so they like to see people. They do. Okay.
Hi, Jess.
All right. We shall start. So this is what's on the agenda. We're going to talk about a few issues that our profession faces, and we're going to talk about recognition versus regulation. We're going to talk a little bit about insurance company coverage, both liability and coverage of our services, why we think board certification is necessary, and then we're going to talk a little bit about the benefits of CanPro membership as well. So let's start with our role. There's always a lot of talk about the difference between dietitians versus holistic nutrition professionals. And we have a position where, we respect the dietitians. They have a university degree. They work in the hospitals. They, work in companies where science is required in terms, and we may not always agree specifically as to what they're doing, but in terms of their professionalism, they're very professional from that regard. They are trained for the hospital work. We are not, and it's not something that, our liability would ever cover us for. But I kind of see us as apples and oranges. So as holistic nutrition professionals, we're much more into the coaching, was probably the best word to use, side of wellness and nutrition. And the problem is the confusion with the public, and it centers around the word nutritionist, because for most of the public who may not be aware that we even exist, if they've been to us, they're not as confused. But if they haven't been to someone in our profession, then they hear the word nutritionist and they just think of it as a blanket term for somebody who recommends healthy food. They don't really see the distinction between what the dietitians might do in the hospital or the coaching elements that we might do in our practice. So we have to be really clear about what our role is. And I see our role, and in CanPro, when we are talking amongst the board members, this is how we see it, is very supportive. It's not just about food. And yes, we have the word nutrition in our name for our profession, but we do so much more than food. Why we run into trouble with them, and I should say before we get into this, is that a lot of dietitians are moving in our direction. It's very important to understand that there's two types of dietitians. There's those that get government positions. There's not that many of them, and they can work for, the Board of Health, or they can work in the hospitals, things like that. And there's not a lot of those positions, and those dietitians' hands are tied. They have limits to what they can do. But many dietitians who don't get those jobs, and from what I understand, they don't pay that well anyway, they go into private practice. And once they go into private practice, they are as free as we are, or an ND or an MD or a chiropractor, to bring in other elements into their practice. And we were just talking, Katie and I were just talking about this before we went live. So you'll see them refer to mindfulness, and they do have more whole foods that they're recommending and things like that. And so it's not that the dietetic profession itself with their scope has changed all that much. It has changed somewhat, but not a lot. But anyone in private practice can do anything as long as they are not running afoul of their regulations or their scope of practice or their liability provider's understanding of what they do. And I'll talk more about that in a minute. So a lot of us, I read the Facebook groups, Jess reads them. So whenever, there's some comment made by a dietitian that may not be nice to us, the holistic nutritionists assume they're jealous of us, or it's because they're afraid of competition or something like that. I don't know that to be true or not, and I'm not going to speculate about that. I don't think that's, from what I've talked to dietitians, I don't think that's what it is. CanPro actually met with the Dietitians of Canada chapter in Ontario 2 years ago. It'll be 2 years this September. And we were there at their invitation. And it all happened because at the time in Ontario, there were some rogue dietitians who were trying to get the use of the word nutritionist solely for Ontario, for dietitians, similar to what had happened in Alberta and Nova Scotia. And they put up a petition on change.org, basically saying why they were doing this. And so we put up our own petition saying why we should be recognized. And that got the attention of the Dietitians of Canada chapter in Ontario, and they invited us to their offices downtown Toronto. And they also invited the lawyer from the College of Dietitians. So these are the people who work with the government. And we had a lovely meeting. They couldn't have been nicer, and they were asking us all kinds of questions about what we do, because they really wanted to have us play nice in the playground together. They were very sincere, and they were very nice. So it's not, I don't think it's a competition thing. Now, what they do say, and this has been cited in other places, it's often cited when they do their promotional information. They're always concerned, they say, by the lack of standards of those who use the word nutritionist. Now, they don't necessarily mean us. There are other people using the word nutritionists who are not holistic nutritionists and do not receive the amount of training that we receive. So we do receive a lot of training. We don't have a university degree like they do, but we have a college level designation, which, again, many professions, massage therapists and dental hygienists and all kinds of other professions have college level. So there's nothing wrong with the level of education we have. It is legit, and we worked hard to get our designation. And many dietitians are aware that those of us who call ourselves holistic nutritionists or holistic nutrition professionals have that qualification, and they often are not referring to us, but then others will lump us into a bigger group, and it's just anyone who uses the word nutritionist other than them. And what they say, and this is what they say to government, it's an issue of protecting the public. So when we were meeting with the dietitians, basically they said why this rogue group in Ontario got their shorts in a knot is basically because they heard it happened to be a holistic nutritionist, because they told us who it was and we happen to know who this person is, said something on TV that was somewhat not responsible. And I didn't disagree with them per se. So we let them know that that's, and they said the same thing to us. They said, we have dietitians who say terrible things too. It's not that it's more about what does the profession say is what they wanted to know when we were having this meeting. So what we have to do is make sure that we as a profession are presenting to the public, whether it's to the dietitians or it's to the doctors or it's to the chiropractors or the naturopaths or the government or the insurance companies or the public itself, that, we do have standards and we do have training, and what we do should be of interest because it's kind of unique and we do see results. So this is about messaging more than anything else. And if we had more of a consistent message going out to the public, we would be not so vulnerable. I think that's the best way to put it. So where do we fit? Well, I think we're different. I think we're different than every other profession. I see this coaching role that we play with regard to nutrition to be quite essential to what we do. I think the practical strategies that we use, so, we take people to the store and we go into their kitchens if they let us, or, we tend to adjust for each client as needed. I think that those are valuable. A lot of professions can't do that. We do ongoing support, and by that I mean certainly other professions do ongoing support as well, but it's not we don't just support from a nutritional basis. We support from, I'm going to use this word, an emotional basis. And I don't mean that we are helping them with their emotional work. What I'm saying is that when they feel overwhelmed and they feel confused, we have it within our scope of practice to set up a session with them where we can just talk through strategies and roadblocks. And I know of no other profession that does that within scope of practice as ongoing part of what they do. You might find some individual practitioners who do that, but it's not necessarily profession-wide. So I think that makes us very, very different. We also work with lifestyle changes. Now, Katie was telling me before we went live, she was on the Dietitians of BC's website, and she saw mentions of mindfulness, and I might let you tell her what she also read, but we'll save that for later in case we want to revisit this topic. It's kind of funny. What was on their website, but because we don't want this to be about the dietitians, we want this to be about us. But we do face some obstacles, and it doesn't make sense not to admit that we do, because we do. But that being said, there are many beneficial relationships between dietitians and nutritionists where they work in the same clinic and they get along just fine. We were told this by the Dietitians of Canada chapter president when we met with them, and she told us that this is why they want to find a way to play nice in the playground. And she also told us that the BC chapter president wanted the same thing. So it's not unique to Ontario. I know it's a little different in other provinces. And so that's why we have to kind of come up with a strong message and show standards to have people understand what we do and how well we're trained. And of course, we do the body, mind, spirit support as well. Again, we're not counselors and we're not therapists, but we know enough to look and point people in the right direction to see if that would be something that would be helpful to them. And some of us do have modalities also that are separate from our holistic nutrition that, would lead them in that direction as well. So I see, and CanPro, we worked this out as a strategy, kind of how we define our role. that people ask us. We listen and validate the client. That's a big thing. The listening and letting them know they have a collaborator to work with is, I think, essential to what we do. Obviously, we educate around root causes and provide answers. We don't, symptom manage. And we try to create solution-based protocols for the individual. We provide practical lifestyle change recommendations to support the client. And we also provide ongoing accountability for them to help improve compliance and efficacy, because we can play this role of listening and hearing what their stumbling blocks are and why they're feeling overwhelmed, etc. And what you add this all up, it creates a huge difference between us and other professions. But we can't do it if we're following the lead of other professions. And I sometimes think that as holistic nutritionists, we have a bit of an inferiority complex, and that we somehow think that maybe NDs know more than we do. Yes, they do know more than we do in a number of areas, but one area they don't know more than we do is food and nutrition. So we're the specialists in food and nutrition. They have many modalities. Nutrition is just one of them. So one of the things that we do, which is different from what, say, naturopaths do or medical doctors do, is that we create protocols that are unique to the profession and unique to the individual. And what I'm seeing lately, which has been a little disheartening, is very restrictive food protocols that are being recommended by NDs being implemented, not because they're working with the ND, but because they have gone to a seminar and this is what the ND said. It's one thing when you're working with the ND, you often don't have any choice. But when you're not working with the ND and you're in your own practice, to suddenly start pulling out all the whole foods that we're working so hard to put in doesn't seem to make any sense. And that's what I'm seeing. And we have to understand the perspective. From an ND perspective, they don't have time to work with food. They don't have time to take people to the store. They don't have time to show them cooking methods, share recipes, ideas, strategize, stress management, time management, all the things that we get to do. So what they like to do is pull out anything that could possibly ever be a problem to anyone, anywhere, and then use a bunch of supplements to try and get a result. And I'm not saying that's right or wrong. I'm just saying that's what they do, and it's not what we do. And in a perfect world, they would see what we can do with food and let us handle the food. I think we could deliver to them a better playing field for the client's body that would allow the supplements to work more effectively. I can see a really good side-by-side relationship that they're not seeing because they don't really understand what we can do. But when Jess and I were talking back and forth by email, she asked a question which is valid. She said, well, what about somebody who is a GAPS practitioner? So if you are familiar with the GAPS diet, it is quite restrictive. But there's a difference, okay? So someone who's a GAPS practitioner is a holistic nutritionist and they are a GAPS practitioner. They have two hats. So that means that somebody coming to them, especially if they're advertising they're a GAPS practitioner, is more than likely coming to them because they maybe heard about GAPS or read about it and they want to try it. Or it might be something that the holistic nutritionist decides to, when they're seeing clients, they'll say, okay, you know what, I think the GAPS program would be best for this client, right? There's nothing that says because a holistic nutritionist is a GAPS practitioner that they're always using the GAPS GAPS protocol on all their clients. Because they're a holistic nutritionist, they have enough knowledge to make the distinction, and they may apply GAPS in some cases, and they may apply it in not. And that's a different thing. You're still individualizing. It's this trend to just pull out all the foods because they have an autoimmune condition or some other reason like that. And it's hurting people. And there's studies coming out showing that when you pull out a lot of these foods, the person actually gets worse, not better, because they didn't actually have a problem with all these foods, and you just took out a whole whack of things that had nutrients in them. And I've seen it, and I'm sure you have too, where they're left not knowing what to eat. So again, shows a role for us because we can help them, and we can help the ND maybe not be quite so restrictive by doing more of a trial and error approach, food journal, quasi-elimination diet and reentry. We have lots of little solutions that might make it easier for the ND to feel comfortable that they're not pulling everything out and that the client is still left with lots of food. Lots of things we can do. I find that this type of protocol, it very much mirrors the medical model in many respects, in that it's not allowing for the individuality of the person. So we don't need to follow that. And we may be in a situation where a client has come to us and they're following it because that's what their ND and they're not wanting to do anything differently. That's fine. Or we're working with the ND directly. That's fine. But we should always be trying to help educate. And I'll give you a perfect example. One of our members is a cancer specialist. And when she first graduated, she got a job in a clinic with an ND who specializes in cancer and putting people on the ketogenic diet. And by working with her and her educating him, he no longer puts people automatically on the ketogenic diet. As a matter of fact, he's not doing it all that much at all. And that's only because she worked very hard, bit by bit, to show him different things. She's very good at finding research and showing benefits of things and stuff like that. And she was able to do it. So that doesn't mean, they just need to know what we can do and see what we're capable of. So in terms of growing our profession, it's going to take several strategies. Obviously, we have to act with integrity within our code of ethics and scope of practice. And we want to get into the habit of sending primary care providers and employers what are called client care letters. So this is just a letter that you would craft on your letterhead, basically informing the medical doctor, the naturopath, the chiropractor, and the employers that you are seeing the client for the nutrition purposes or lifestyle purposes or whatever, however you want to frame it. And each client can give this to their primary care providers or their employers as they see fit. So in some cases, some clients may not want to give it to their employer, for confidentiality reasons. But they might want to also give it to them because it might help them get coverage for services, especially all the liability programs that have that discretionary fund that they can use on whatever they like. So a lot of extended healthcare benefit packages now have this.
If I may interject, one other reason for them being motivated to give it to their doctor or their primary care provider is because in my experience, I've had a lot of clients with anxiety with needing to remember to suggest, because it's out of our scope of practice to do any tests, right? Or diagnose anything. And so it's up to us to reach out to the medical professionals or the naturopaths who can do this because it is in their scope of practice. And so saying that, I've had lots of people with anxiety, with the fact that they might forget by the time that they make a doctor's appointment or a naturopath doctor's appointment. And it's just that they don't understand what to ask for, what stool sample or why, or blood test or why. And so giving them that they can go and just give a piece of paper, and it's very nicely written, very professional, and it's just a suggestion from us. And what the doctor does with that is up to them because that's their scope. But we're staying within ours, and we're just doing what we can and giving it to them on a nice piece of paper.
And that is an excellent example, Katie, because if we want them to understand that we're professional, this is what a professional would do. Other professions would do this too. And it builds trust with us and the medical provider or the naturopath or the chiropractor or whoever. They're saying, okay, this isn't some rogue person just doing whatever. this person actually has standards of professionalism because I got this nice letter, because it's a professional letter. It's not an uncommon thing. And by doing that, and I know this to be true, I know many holistic nutritionists who have regular referrals from medical doctors because they got to know them through the client originally. So the nutritionist sent the client to the medical doctor for some purpose. And the medical doctor was open-minded enough to keep an eye on this situation and see what happened. So, saw things they liked because the client got results or whatever, and then started referring other patients to the holistic nutritionist. And that's how it's done. And that's how you sort of spread the word to raise awareness. It's got to be done consistently by members within our profession. It has to be.
I agree.
Lorene, I'm not sure if you can see the chat, but people are asking if we have a template for a client care letter.
Does CanPro?
Yeah.
We do have a letter more specific towards getting insurance coverage, but I believe there's also, I'll have to check the CanPro member section, but I believe there is some type of letter that they can use. And there's a receipt they can use and things like that.
If anybody has a standard feedback form that they've made for their own business, they can always include a subsection that's for the medical professional that they're referring out to, or just insert whatever we can give to them, obviously, as well. I'm imagining a lot of people who are signed on are going into business as a nutritionist with their own practice, yes?
I know most are interested in this. I know that many haven't. They're either doing it part-time or seeing clients as they come, and then some are relatively new to the profession.
That's great, and it's a great thing to implement.
Yeah.
Yeah.
No, I think this is a really good thing. And obviously, if we promote our services in the corporate sector, this is another way to have. It's just we've done some work in the corporate sector at CanPro, and I am boggled by how many businesses there are out there. In our own little world, we only come across so many businesses, but when you start looking into it, there's just thousands and thousands. So the more we're in those corporate sectors, whether we're doing lunch and learns or many of them are setting up where people can come and have 15-minute sessions, which I think is too short, but that's what they do if they're paying for your service. Sometimes it's 20 minutes. They're doing things like that. They're doing health fairs. All of these things are really good ways of sort of spreading the word. And then, of course, we have to promote our profession to the public. Because they're the ones who have to sort of drive the demand for our services. And that can be done in many ways. So there are online strategies, there are social media strategies, there's old-fashioned strategies where you just get known in your area, you go to community centers, you go and talk to people who are running different types of organizations within your area. There's all kinds of ways you do have to be out and about, but the more and more of us do this, the more easy it is for us to be known. And it's going to be a long, long time before our profession is big enough and strong enough and financially stable enough that we can put commercials on the TV like the naturopaths did. And I would just say, and because we know this too, so here in Ontario, when the naturopaths got regulated, they thought it was going to give them credibility. That's why they agreed to be regulated. And what they found is it got them no credibility at all, and all it did was raise their annual rates and their liability insurance. They ended up having to do their own promotion, and I remember seeing the commercials on TV about going to see a naturopath. So they did their own public awareness, and then that's when we started to see them, more and more people saying, my ND this, my ND that, right? So they obviously were, I know most people I know have seen an ND, and many have one they see on a regular basis. So again, at some point we have to do that, but we're not big enough or strong enough to do that yet. And it has to be a consistent voice. It has to be, saying the same message, or the public will get confused, right? And then the other thing we can do, and this is going to be more helpful for jobs, is to promote to other professionals. So NDs, MDs, chiropractors, they all have practices where they could be referring clients, or, well, their patients, our clients, to us. And of course, companies. There's lots of companies that are in the health industry. We are doing quite well with those. A lot of them hire us already, but there's a lot of really good jobs within supplement companies and health food companies right now. However, this profession isn't likely to grow if we don't stick with a holistic nutrition view. So it's very important that we're always looking at the whole picture of a person's life. We're not judging foods because somebody said some whole food was bad, when really the research is not there to show it. We understand the systems in the body. We understand what happens when the gut doesn't work. I mean, we don't understand it all. I mean, it's a great area of research, and there's still so much more to learn, but we know the basics. That if the gut doesn't work well, a lot of other things aren't going to work well. We know what happens when the liver's not getting enough nutrition, or the adrenals are too stressed, or you pick a body part. We are well aware, and that is the holistic nutrition approach, is to try and fix systems in the body, not pick on whole foods. We know that supplements have their limitation, that they have to have a healthy lifestyle, and they have to lower stress, and they need to get lots of good sleep. And we work on, like, what other professions in their scope work on sleep? What other profession talks about chewing? Do you know how successful I've been telling people to chew their food? It's a miracle. GERD disappears. When you tell, not all the time, but many times, all they have to do is chew their food, slow down, chew their foods, stop drinking with their meals. They're simple suggestions, but they're powerful. And we don't give them enough credit. But that is part of the holistic nutrition view. And we will never get the respect of other professions. And I mean this as a profession as a whole, because many of us get respect because we earn it as individuals when we work with other professionals. But we're not going to get it as a whole if we don't know the value or show the value of what we do. And they will continue to think of us as juniors to what they do. So that's how the naturopaths see us. Medical doctors, not quite as much, because they don't even know what we are to the most respect. And if they do tend to respect us because they've discovered us when they found one that they work with. But certainly chiropractors, even dietitians, if we were in a clinic, depending on who was running the clinic, especially if it was a medical doctor clinic, often the dietitian is seen as the senior and then holistic nutritionist the junior. And we're doing two completely different things. So we have to show them that. All right, so that brings us to the topic of regulation, which I know a lot of graduates think that this is what would be the answer. I just told you the story of the NDs. I got that straight from the horse's mouth. That was a presentation an ND did for us many years ago, and he was the president of the ND Association in Ontario. And so he's the one who told us that. So first of all, what does it mean to be regulated? It basically means the government has stepped in, usually working with the profession, set up the scope of practice and the rules that will now guide the profession, and they are insisting that they be done as a government-regulated profession. That's what it means. And we won't be regulated because we're deemed not harmful. So what we have to understand once and for all, and I don't care what anybody tells you, we'd have to, within scope, have the potential to harm. And it has to be serious harm, okay? So homeopaths were originally regulated because someone took on a cancer patient as a primary care provider and the cancer patient died. So the Ontario government wanted to regulate the homeopaths, so they had the right to force the practitioner to send the patient to an oncologist if they deemed necessary. That's the kind of harm we're talking about. If you're wondering why massage therapists are regulated, it has nothing to do with massage. It has to do with sex. If you read and I've read them, if you read their regulations, it's all about what to touch, what not to touch, where to touch, how far to stand away from them, what you wear, what you don't wear. That's what it's all about. So regulation is about protecting the public from harm, and we are deemed not harmful. And the only reason the dietitians are regulated is because of the work they do in the hospital. The doctors insisted on it. They wanted to make sure they wouldn't kill their patients. So that's why they're regulated, and it's for really serious things like premature babies and things like that, where you have to be so careful with the nutrients that it could cause harm if you give them the wrong much too soon or whatever. And the biggest reason is governments don't like the cost of regulation. It's an expensive process. You have to have a fairly high number. A few years ago, the personal support workers in Ontario tried to get regulated. There's 6,000 of them, and they were turned down. In Ontario, the paramedics are not regulated by the government. They are self-regulated with government recognition, which I'm going to talk about. And so are the blood technicians. So this is not an uncommon thing that not all professions are regulated. And if you're wondering why a paramedic is not regulated when it's about harm, it's because they're overseen by the doctors. And even though they can still do harm within their own scope, the government, as far as it's concerned, when they weigh the cost to benefit ratio, still feel it's better that they stay self-regulated. So that brings us to something called government recognition, self-regulation. So we can be recognized. This is a big project. It requires a number of steps. Our standards must match those of the other regulated professions. So that's first and foremost. And that's one of the things that we've worked on at CanPro. And we have to have numbers in order to be taken seriously. They're never going to do this for 6 people. So it means there has to be a fairly large group. And then there are some other steps, and I'll talk about this a little bit later. I just want to cover some other basics first, and then I'll talk a little bit more about that. All right, so we do have some, what's the word I'm looking for? Legal requirements. So our scope of practice, which we've been taught and we know, we do have to adhere to it because of liability insurance. So it's very important to stay in scope, and they need to know what they're covering. So they understand whatever liability provider you have. They understand what the scope is for holistic nutritionist. So for example, I gave you and it's not the best example, but I gave you the example of the GAPS practitioner being one modality and holistic nutritionist being another. They're 2 hats. So the liability and provider should really be told that that's what they're doing. I don't think they'd have a big issue because it is all in and around food, so it's not a huge concern to them. A better example would be supplements. So we follow bottle instructions because we are not regulated by the government, and only the government can allow someone to do what they call therapeutic dosing, which is exceed the bottle recommendation. So they gave it to the NDs. The medical doctors have it too. So we don't have it, and if we don't stay in scope and follow the bottle recommendations, and something happens and we get sued, our liability provider will not protect us because we strayed out of scope. So what they're looking for is that we've been educated in whatever they're covering, and so they will cover us for quite a lot of things that we have been trained for. So you need to make sure your liability provider covers you for whatever you will be doing. If you take on another hat, even it's like it's a Reiki practitioner or whatever, you just need to tell your provider. Most will provide you with coverage for that. It's often not any extra dollars. Sometimes it's a little bit extra dollars. It's not double. And they just need to know what it is you're doing and what they're covering you for. And they will cover you, if it's a good provider, they'll cover you for any programs that you do, any one-on-one consulting, online consultations. I know that our liability provider will cover us even for outside the country, their only condition, and it makes perfect sense, is that the client, if they ever sue you, has to come to Canada to sue you. And they'd have to do that anyway because you can't be sued from another country anyway. So that makes perfect sense. They cover cooking classes. Normally, liability will not cover us for cooking classes because we weren't trained in cooking, but we made an arrangement, and I know this is covered with some other insurance companies as well. If you get your food and health safety certificate, it's mandatory with our coverage. It's a simple thing to do. You can get it online from the NFSTP, National Food Safety Training Programs, and it's a 5-year certificate, and it covers you for all of Canada. And it's not expensive. It costs like $45 to take the course and another 20 or some 25 or 30 to take the exam. It can be all done online. They will cover you for email and phone contact. So if you're talking to the client in between sessions, either on the phone or via email, you're covered. It covers you when you do writing against plagiarism or anything else. And anything extra, you just have to discuss, and often it will be included. So understand that this is a legality that we have right now, and it gives us credibility. And so when any suggestions that we're not behaving in a professional manner, we can always rely on our liability provider and the fact that we carry liability insurance to give us some credibility that we are professional and we know what we're doing. In terms of insurance coverage for our services, nutrition is not standard in packages created by insurance companies, and so they must be added by the employer. And even if we have companies that recognize our members, we have several, but if the employer that they provide insurance for has not added nutrition into their package, it doesn't matter. So it's always about the employers. This is why we encourage members to reach out to the human resource people or have their clients reach out to the human resource people to try and get coverage, because a lot of times the human resource people have some discretion, especially when they have those, like I said, personal spending accounts, these discretionary funds that are often put in packages now that they can use where they like. When they do have sorry, were you going to say something?
Oh, I was just going to agree with you. Yeah, it's like when your employer decides to do more coverage on massages and less on the optician. And that they mix and match, right? It's up to the employer to then say, maybe we'll do a little bit less of this and then mix it nutritionist into the package. Same thing.
Yeah. If they have nutrition, obstetrician.
That's it. Carry on.
Okay, so if they do have nutrition, it has to specify us specifically. So if it says dietitian / nutritionist, 9 times out of 10, that means the dietitian, and it does not mean us. However, a quick call to the company can verify that it means us too. Often we would be under wellness practitioner. Sometimes we'd be under holistic nutritionist. Holistic nutrition professional is relatively new, so it's less likely to find that, but it's possible. And it might be there under designation as well. The designation might be there. So it's just a quick phone call. And then if it's not covered, then it's between the client and the employer, not the insurance company. We get a lot of insurance companies contacting us to verify membership. We can tell they're very confused about us and they really don't know what they should be asking for or who. A graduation number is not a professional association number, but the insurance companies think that it is. But we have to be careful not to mislead them and make sure that they are getting what they think they're getting. So, because it has the potential to hurt all of us if we are claiming our services under something that was meant for dietitians. This is not a good thing, and this has been one of the factors in some of the issues that we've faced in some of the provinces with regards to the dietitians. So it's very important that we understand that we need the insurance company to clarify if we're not 100% certain that the nutrition being covered is us. And it's not hard. It's just a question, right?
Can I add something there?
Sure.
One thing that you can do for those of you who are on the call and are members of CanPro, make sure that your CanPro number is on your receipt, and also put on your receipt to contact CanPro for verification of board certification status or membership status or something like that. Because what we don't want to have happen, like Lorene was saying, we don't want someone to see our receipt, like an insurance company to see our receipt and call the dietitians of Canada and say, is this person a member? And they'll say, no, I have no idea who that person is, because they got confused, that they thought they saw a receipt for nutrition, that they just automatically assumed that it was a dietitian. So that's really what we don't want to have happen. So best case scenario is, you know that we're covered before the insurance claim goes in, but just to be on the safe side, something else that you can do is make sure that it says right on your receipt to contact CanPro specifically, put the phone number and the email right there, and then there's just no confusion.
Thank you, Jess. That's a good point. Okay, so what they care about is that somebody like an association can verify your professionalism. That's what they care about. When we started CanPro, like, was 2010 actually, so we've been around for a while. We thought we had to prove that what we do works. We were that naive. We thought people cared, and it turns out they don't care at all, because we live in a culture where people have the freedom to choose to spend their money where they see fit, right? So they're not worried about what we do so much as they're worried, are we doing it within a confined scope and that we're professional and we conduct ourselves. That's what they care about. They want to make sure we're staying within scope, and they want to see upgrading done and verification of upgrading being done on a regular basis. And that's basically what professional associations do. And they often ask if something is in our scope of practice. So we get emails where an insurance company is saying, is this something a holistic nutritionist would do? And they're literally sitting with somebody's claim in their hands, deciding whether they're going to cover it or not. So again, they're not that clear about us. We've done our best. We send out packages to insurance companies explaining who we are and what we do all the time. And the reason we're doing that is to try and spread the word, but it's a big process. Not only there are a lot of companies, there's a lot of insurance companies, which kind of shocked me. And they just want to make sure that we won't cause problems for them or their clients. That's all they care about. It's that we won't get sued. We are in the lowest sue rate there is. Naturopaths are in one of the highest, and the main reason they're being sued, and it was them and a certain type of yoga that's quite strenuous, and I can't remember which one it was, that were getting the most lawsuits from clients. And the reason for the naturopaths is the therapeutic dosing on the supplements. It's why some naturopaths associations, some government-regulated naturopath colleges are limiting some of the things that naturopaths can do right now, because there's so many lawsuits, again, because of therapeutic dosing. So that's all they want. And if we stay within scope, there's not much we can do that they have to worry about. All right, so that brings us to just quickly talking about CanPro. We started in 2000, not the organization, but a group of us got together. We worked under the banner of CSNN-AA at the invitation of CSNN. And we did a lot of research for 3 years. We read other people's regulations. We talked to all kinds of graduates from different schools. We did surveys to see what the profession wanted. We did a lot. And in the end, we decided that we were going to start an organization based on what we had determined. What we had found is that all professions except for ours has what's known as a board certification process. And this is different from your board exams that you write for your nutrition designation. That's your nutrition exam. But what other professions have is after you do that, then you join an association by writing an exam that basically tests on scope of practice and code of ethics and professionalism. And when if we have this, we can demonstrate our professionalism to everyone, and we can keep the liability rates low. And even other professions that are not regulated by the government, such as the fitness instructors, they have this. The Reiki people have this as well. Like everybody has this except us. So most professions, you don't just walk out of the school and boom, you start practicing. You have another step. And so this is what we determined when we looked at all the regulations and talked to all kinds of different people. This is what was missing. So we started the association basically to put this in place along with the other standards that are typical of most professions. And we first we went very complicated. You know, we're always trying to do more than we needed to do. Like I said, we thought we had to prove the value of what we do. So we tried to do a study on diabetes with holistic nutrition strategies. We tried an apprentice program because we knew that a lot of graduates coming out wanted something more anyway, long story short, it was impeding the board certification process. So we decided to make it very simple. We just created an exam like everybody else has. And that's how you get board certified under CanPro. And basically it covers code of ethics, scope of practice, professionalism. That's it. And as I said, nobody cares what we do. They just care that we know what we are doing professionally within scope. It's that simple. And we also have a strategy moving forward for helping the profession. So we are actively marketing to the corporate sector. We are talking with insurance companies. I mentioned several check in with us already. And we have the strongest standards purposely to match other professions. We are networking with other practitioners and companies to create more job opportunities. And we're working with members to provide them with individual support to help them grow their businesses. So this is the part that is very tricky for me to talk about because it has been my experience that to say anything before it happens is always a mistake. So we are currently working on government recognition. We have taken several steps and are halfway through in one province, starting in another province, and getting the research done in a third province. We should have some outcome soon, hopefully in the fall. It has to be done province by province, and we're obviously starting with provinces where we have the most members. We can only represent our members by law, so the government will not talk with us about anybody other than our own members. So we are going very cautiously, very carefully, and what we're trying to get is the government recognition for self-regulation. And it is our goal that with this, we will be delivering a measure of protection for our members so that the future is safe for holistic nutritionists or holistic nutrition professionals to practice their profession and not have to worry about losing rights. So as I said, this is a very, very tricky thing. We are deep in it right now, but we're not in a position, we don't want anybody being misled. That's the big thing. And it's been my experience, if we say too much too soon and somebody misinterprets and then they say something and it always comes back to us. And so we're being very step by step, very methodical, and that's all I'm going to say. Sorry. I've been working on this all week trying to figure out exactly what I was going to say because I don't want to say anything that can
well said.
Okay, good. Thank you. I'm trying not to have anything misinterpreted. It just doesn't help us. I've seen too much over the years. It's actually my 20-year anniversary of graduating from CSNN in August. So needless to say, I've seen a lot of things and a lot of talk, and we just don't want to do that. We want to deliver. Whatever happens is going to happen. So that's where we're at.
Can you see the chat, Lorene?
No.
Okay.
I can't either.
Okay, can you, just a couple people are asking about the situation in Alberta and whether anything there is going to change and whether we could just talk a little bit about
Okay, so one of the provinces that we're actually researching Alberta right now. That is the other two provinces are obviously Ontario and BC, because that's where we have the most members. And our plan is basically, if we can have the precedents set in BC and Ontario, we can go to Alberta and have a conversation. We don't know how much we can do in Alberta. Alberta has unique regulations. For example, only the word regulate or registered can be used by a government regulated profession. So we still have to do our research in Alberta to find exactly what the method is for the recognition. It's going to be slightly different in each province, but we know it's not. We know other professions that are regulated this way in other provinces. So we're going to find that out, and then the goal is to have a conversation. Obviously, people in Alberta have to be involved. So because we're going province by province, we want to set up teams of members in each province, because it doesn't make sense from somebody from Ontario to be speaking in Alberta. This doesn't make any sense, right? So we just don't know. I think we could possibly prevent anything more from happening in Alberta. That I think we could probably do. I think it would allow a little more respect for the profession in Alberta. I would be shocked if we ever got the word back, nutritionist. And the same is true for Nova Scotia. But I think that with what we're doing, we can get nothing more to happen for there to be a recognition of the profession, so that it can have its standing within the health field like anybody else, like the chiropractors, like the massage therapists, like everybody else. That's what I think can be done in Alberta. It's unfortunate in Alberta that you have a particularly what's the word? The Dietitians of Canada chapter in Alberta is very aggressive. There's a word. That's a good word, right? They're very aggressive and have been very aggressive. For what reasons, we don't know, because there's been no conversation with them. But I do think a conversation can be had with them, but we need more behind us. And we think if we've had success in Ontario and BC, that may have them, especially the government, because remember, the government is separate from the Dietitians of Canada in Alberta. So the Alberta government, especially now where they probably are looking for cost-cutting measures, they might be open to hearing what we have to say, I think. And we might actually, maybe if they see what we're doing, maybe the Dietitians of Canada chapter in Alberta would actually cool their jets and calm down. So that's the best we can say right now.
Christy says that she's in. So Christy, I'm assuming you're in Alberta. And if you're in terms of working on this and helping to advocate in Alberta, what you should do is contact the CanPro office. Is that info@canpro.com, Lorene?
.org.
Info@canpro.org. Just to let us know who you are, what you're doing, and so we can keep you in the loop.
Yeah, because the thing that we have learned as a result of doing all this work for the last 9 years is that national is great from maybe a marketing perspective, but for individual provinces, there has to be strong representation within the provinces. And it's going to be difficult for some provinces. There's just not enough holistic nutritionists. But there are several provinces where there are enough. Okay. So again, we need members like anybody else, because the more members we have, the easier it is to have a voice. One of the things we know about government is it does not like to interfere with somebody's ability to earn a living. That is never their stated intention. And so if there's enough people that they know that any decisions they're making might interfere, they do take back. They do surveys about these things. I don't know if you know that, but governments do surveys about how things are going to affect things before they make decisions. So what we're trying to do is create a demand, even though we may not have a way to fill it, because if we have too many demands for nutritionists and we don't have enough members, we don't know how to fill it. But hey, got to start somewhere. We figured we'd start with the demand. So if you would be interested in joining CanPro and investing in your profession, you like what we've had to say tonight and kind of the direction we're going, we kindly invite you to join. We have a voluntary board, and we are unique as an association in that we've done that on purpose. Eventually, we'd like to have enough members and have, a paid marketing director and all that kind of stuff. But in the short term, we want to stay very flexible. And because no one is earning a living from doing the work at CanPro, and we do have a bigger board as a result of that, so that, many hands light work. We do have a paid admin person who runs the office and sets up the memberships and answers questions, and then she forwards questions to us as needed for us to give information to people. But other than that, there's nobody that would lose their job under any circumstances for any reason if we had an opportunity to create an even bigger organization with other members or associations or whatever. So we're a very, very flexible group. And all the money that CanPro gets, with the exception of, the admin person and the person who does the newsletters, is available to go towards this project. And that makes us very unique. And as a CanPro member, you're going to have a source of support to help grow your business. And you have someone to vouch and verify your standing to increase your credibility. And as I said, your membership money goes towards what we're doing. We have a very low liability rate, $150 a year. You get documents to use in your practice. You have upgrading options plus free webinars that we post a lot of information about. If you're on our mailing list, you already know that we send out a lot about webinars and workshops and things like that. And then when you join, you get a free training of one of these different trainings that we have. They're online things, and they can help you with some information. And that's our costs. If you are past being a new graduate, it's $285. If you are a new graduate within 6 months, and I will say it's a very, very loose 6 months, it's $235. And if you're not practicing but you want to support what we're doing, you can join as an associate for $100 a year. And for all of the people who've signed up for this webinar, we are going to send you a free little ebook called 5 Strategies to Convert Your Prospects to Paying Clients. So that's the end of my presentation. And if you have any questions, we will take them now, and whatever discussion you'd like to have. Thank you very much.
I just put in the chat the link to our website, which is canpro.org, and the particular page where you can see all the membership options. So that's how you can apply for membership. There is a renewal fee per year, Christina. It's a 1-year membership, and you'll see on that page it's an annual fee, Kim. So you can see on that page products/memberships that I just posted. Here, I'll post it again. All of the different options.
Yeah. So once you're board certified, the renewal is $255. If you stay we don't force you to be board certified because it's when you're ready. So you can join first, and then when you're ready, we send you the materials. There's no cost for the exam, which is unusual for an association, and there's no cost for the materials at this time. And you just learn the materials, write the exam, usually via proctor in your area. You find the proctor. Generally speaking, we have suggestions, obviously, in some areas. And that's it. And you become board certified. Jen says
Jen's saying she'd love to be board certified. Really, I mean, as a practicing nutritionist myself, I think really it only makes sense for everybody to join. depending on, sorry, that's not what I meant to say. What I meant to, once you join and get your feet wet, if you're starting your practice, to go through the board membership, the board certification process, because why not, right? And that, like Lorene was saying, like there's no cost to you. And as Lorene was saying, that's how we can, as an association, really vouch for your service. So because we know that you know your scope of practice, we know you know your code of ethics, you know all this stuff, and so it has nothing to do with your nutrition knowledge. It has everything to do with, we know that you will conduct yourself professionally, and therefore, as an association, we can vouch for you. So when people call and say, hey, you know, is this person a member? We'd like to hire them. And we say, yeah, we vouch for that person. Because if you don't go through a process, we don't know, right?
And then we do get complaint. There's one question here. Is it an annual fee? Yes, it's an annual fee. We do get people calling into the CanPro office all the time, not all the time, but frequently, complaining about a holistic nutritionist. And fortunately for us, so far it's not been one of our members. But there's nothing we can do for that person if they're not a member. We can't, because one of the things an association does is help with complaints and have a fair resolution so that there's no lawsuit. Because you have to understand that once you are sued, your rate goes up. And if enough of us get sued, all of our rates go up. So obviously we want to always be able to resolve any disputes without any legalities involved, because that's the only way to keep the liability rate down. And it's considered to be incredibly professional by insurance companies and governments and other professions that we would have that process as well.
Yeah, you're right,
exactly.
Jen.
And just to progress the profession even further, if we're all professional and we're all keeping the same standard and keeping updated with our scope of practice, and even just having the CanPro behind our name, then it's going to progress our profession so much. And that's exactly what we want to happen. And so if anybody has any questions in regard to business and stuff, like, we'd love to hear them, right? We were talking about this in the last board meeting, that we want to cater to what you actually want to know and what's going to help you have business and get clients. And that's part of why we have this handout, right? So let us know. We want to help you.
Something that I thought of as you were talking is people were asking about a template for the client care letter, and things like that. And so that's feedback for us. And the more we have these webinars, the more we get this feedback from what you guys need in the field. One of the big bonuses is that we're, like, the people who are on the board, not all of them, but most of them are actually in the field also practicing. So we draw on our own experience of what the public needs and what other professionals need. And clearly we need to define ourselves better. So this client care letter is something that we can put together. But the issue that we have is that we can really only put it together for our members, because our members are the only people that we can really vouch for, right? So we're kind of stuck in terms of, like, we would love to just see the whole profession just grow, like, no matter who. And yes, we have an issue with there being several associations, but we can't do that as an association, because nobody is going to take us seriously if we don't just focus on our members. So I think as a board, I think we'll take this maybe up at the next meeting to look at creating this sort of client care letter template, and maybe even like a little PowerPoint video that we can give to our members so that they can tell the chiropractors and the doctors that they work with and the naturopaths that we work with what we do really well. Because I know I've met lots of people who are like, I don't know what you do. Like, they would never refer to me because they don't know what I do until I sit down with them and have the conversation and stuff. So this is the kind of thing we want to make easier for you guys.
Okay, so that's a great point. And I'm glad you pointed out that one of the reasons the three of us are on this is because we are in the field. So we get it, we understand it. There's been several questions, and they're,
Trish is in. Welcome, Trish. Jen's in.
Jen's asking if there's a promo code. No, there's not a promo code for professional association, but sometimes we give promo codes for, trainings or for workshops and stuff like that. But no, there's no promo code.
The promo code is that you get
there's where did it go? Where did you go, Judith? it says CSNN is launching a new curriculum this September. And when I saw Judith say hi at the beginning, I wondered if this was Judith, the Judith that I know from CSNN. I think it may be. Yes, CSNN has a very interesting new curriculum with lots of good new information in it. I've seen the outline for it, so that's going to be fun too. This is the thing, our profession grows in many ways, many ways. And Jenna's saying client care letter would be amazing and totally understand about vouching for your members. And Jen said, I just signed up for that part too. Well, okay.
Andrew wants a review quickly of what the board certification.
Oh, great. So simple, very simple. Once you join first, you request the materials when you're ready. Once you're ready to write the exam, you write the exam. It is scheduled as a 3-hour exam, but most people do it in about an hour to an hour and a half. You find a proctor. We send the exam to the proctor sends it back to us. Very simple, very straightforward.
We send you the materials, right? Did you say that
Yep,
part?
yep.
Yeah, we send you what to study.
Yeah, and I think somebody also asked if there was going to be a replay. Yes, there is a replay, and we'll be sending that out to you with your gift of the ebook. So, yes, Jen, I suspected that it was you. It's a new graduate, I think, if it's who I think it is. Sandra says, what's on the exam? Scope of practice, code of ethics. We have a bit of nutrition stuff, not much. It's based on some diabetes work we did, but again, we send you, see, it was her. Yeah, I knew it. I just saw her 2 days ago when she picked up her certificate. Yeah, so we just tried to make it like we have some ethical questions and we have some research questions, but again, it's all in the materials that we send to you to study from. So, we made it a simple, straightforward process.
Who's baby?
Kitty.
Oh,
all right.
Okay, Catherine, I'm going to take Catherine's question.
Okay.
What's the difference between us and CANNP? So we're in a situation right now where we have 3 professional associations and we have an alumni association if you went to CSNN. I don't know, does IHN have an alumni association as well?
I have heard they do, but I don't think it's well established like CSNNAA.
Okay, so first of all, alumni association is very, very different from a professional association. We do very different things. The alumni association is just the school, and they just help you as a graduate of the school, but they have nothing to do with you as a professional. We are a professional association. CANNP is a professional association, and IONC is a professional association. So they're apples and oranges. And this is where and we talk to each other. So we and CANNP in particular we speak quite a bit about we're trying to do the same thing in different ways. So we're all trying to elevate the profession. We're all trying to better define ourselves. We all have the same kind of definition of who we are and what we do. We're just going about it. We just have a few different projects on the go. And this is why we are still 2 separate associations. So what matters most, this is my personal opinion, I think what matters most is that you join, if you're going to be a professional in this profession, and you're going to work as a professional, you join a professional association. You've heard what we're doing. If you want to compare us to what CANNP is doing, by all means, give them a call or, I don't know, talk to them and find out what they're doing and just make a decision. So we can.
And by the way, CSNNAA does some great work too and has a lot of benefits as well. So, they're there for you as well. And we are in regular contact with them as well. They are aware of what we are doing and are very supportive. So this is when I was talking about how we want to remain flexible. And therefore, this is why we have volunteers. This is one of the things I was referring to, so that if we were to join forces, there's nothing impeding us. We don't have to worry about someone losing their job or because we merged with an association or consolidate. We don't have to worry about that. So we're very flexible. We are very flexible.
Do you see Carrie's question? Is there a time frame from when you get the exam materials until when you can actually write the test?
No. So you're the one studying. You decide when you're writing the test. It's up to you. We've had some people do it within 2 weeks. We've had some people take 3 months. We've had some people get the materials and they still haven't written it. So when you're a professional, um, it's your call. It's your business. It's your life. It's your profession. You have to make the decisions that are right for you.
Yeah. You're welcome, Trish. Yeah, as an IHN grad, you're welcome to join CanPro. We have a very specific list of that we recognize. This is another thing we have to do as a professional association, and different associations have different guidelines as to who to join. But we have to do that because CanPro is vouching for your professionalism and your work. So one of the reasons why we need a professional association is so that different people from different schools who have the same standard of practice can feel some kind of unison. So I'm so glad you found us, Trish.
We have a number of IHN grads, and we welcome them. CSNN grads, IHN grads, Edison grads, Pacific Rim grads, we all get along very well together. We've worked in many circumstances. A live academy is not approved in our association, not because it's not a good program. It's a very good program, but it doesn't have the amount of hours, case studies, and detail that would, and the symptomatology that we all learn as holistic nutrition professionals. So no, they are not members, even though I don't have a problem with the program or anything like that. Okay. Are there any other questions? You were all very good. This was good.
I'm going to scan through.
And yeah, I don't see, I think we got them all.
Yay.
All right. Well, thank you very much, everyone, for attending. The more of you that we see as members would be fabulous. And I hope that we've given you some stuff to think about and to, consider with regard to your own business and your profession. We all know that it's difficult to build a business as a practice. There's a whole other side to this from a marketing business perspective that if you're starting out, you're about to find out. And and we know that it's difficult. That's why we want to try and get as much support for you as possible. All right, so I don't see any more questions. So I'm going to say good night and thank you everyone for attending, and hopefully we'll see you some other time on another webinar. Good night, everyone.
Bye.